kañ nga gëj a dem lopitaan pour nemmeeku sa wér-gu-yaram
ndax xam nga sa wér-gu-yaram fu mu toll
est-ce que yaa ngi bàyyi xel si li ngay lekka
wala exercise bokk na si li ngay sóoraale si sa dundu pour am ci lu la leer toppaleen ñu leen di bu ne si suñ programme yi health check nga xam ne lépp lu ñuy waxtaanee dina méngoo ak sa wér-gu-yaram.
I am Dr. HASSAN AZADEH, a senior lecturer at the University of the Gambia and the clinical director of the MEDICARE health services. I've been asked to talk about hypertension or high blood pressure. This is a very common and very interesting topic. High blood pressure is in the Gambia is one of the highest number of the disease we come across when the patient come into our clinic. By recent statistic, about 34% of adult Gambian, they are having high blood pressure, hypertension. And unfortunately, about 80% of those people, they don't even know that they are having high blood pressure until, unfortunately, it will come to symptoms and more life-threatening symptoms. And this is the time, due to the symptoms, they eventually discover that there is something wrong with them. They have start having headache, or the visions are not doubled, and eventually they might have a kind of nausea, and even up to the vomiting. So it means when the symptom arises and such a severity, it means that hypertension is on and is quite a higher of the high blood pressure. Just to demonstrate what is normal high blood pressure and what is abnormal high blood pressure. For that, I am taking the blood pressure of a patient next to me, and then we will show to you how to take blood pressure and how you will see at the screen of the digital blood pressure machine, or eventually you can hear it through the stethoscope. So I'm trying now to this is the manchet we put at the arm of the patient. We ask the patient to relax at the table, and while I am talking about this digital blood pressure machine, there should not be any noise or any talk from the patients. Otherwise, it will irritate. So we press here and wait to see two different levels, a high level and a lower level. The high level is when the blood approaches the heart. Lower level is the blood leaving the heart. Normal blood pressure, there should be about 120 over 80, 110 over 70. Anything beyond that, we call it either mild, moderate, or severe hypertension. So the hypertension of this patient I'm trying to check, as we can see, it shows about 125 over 60, and his pulse is about 79. So it means the blood pressure of this young man is very normal, absolutely normal. If that 125 would be beyond 140, it means he would have high blood pressure. If the second level would be beyond the 90, then would say, yeah, this is kind of hypertension we were talking about. So luckily for this patient, his blood pressure is normal, and when you go to any clinic, they would do the same when you're taking your blood pressure. And they will look at the two different levels, which is the high, which is lowest. Now you're demonstrated for you to know high 125, 60, and his pulse is 79. An absolute normal blood pressure, absolute normal heartbeat rate. As demonstrated, that is the way we check the blood pressure in the clinic, or if you eventually have the suspected having blood pressure. Also, these machines are available from the pharmacy to be bought, and then also I demonstrated how you take your blood pressure. If you have the machine at home, you can do it possibly twice a week and record it. If still are in the range of normal, then you don't have a high blood pressure. If it goes beyond of 120, goes to 140, and the higher level, the lower level is about 90, that is the time you should consider that eventually your blood pressure is not normal anymore. So this is the time you should come to the clinic and to see a senior nurse, to see doctors, and they also have their own machine. They will check it, and then if the blood pressure is beyond the normal, there are some treatment for it. We divided the blood pressure in 3 different levels. The one is mild, moderate, and severe. So for this different level, there are different type of the treatment. But God forbid, if the blood pressure is like starting from mild become moderate, and that person is not aware of it, that can gradually from the moderate eventually to become a severe hypertension. Sometimes it can go up to 180, 110, 220, over 140. If reached that high, it means that this is a very severe, life-threatening hypertension, the high blood pressure. So today is my duty to give you some awareness, some advice, and also make sure that you taking this advice, because as I said at the beginning, about 34% of the adult Gambian, they are having hypertension. Now, the symptom of even a mild hypertension is simply headache. Is headache, and they have difficulty eventually to see. Sometimes they see even double pictures when you see. So it's getting a bit higher. Sometimes they starting to have a kind of nausea. So these are the beginning of the symptom. The symptom can be more severely. People can faint, people can collapse, and this is the time is then really is very high. Let me give you one advice. The blood pressure, high blood pressure, is avoidable. I would like to repeat it. The blood pressure, high blood pressure, could be avoided. Could be avoided by people are aware of it. Usually by the age-wise, the hypertension started beyond the 40 years of age, in particular by men more than by women. When you come to that age, and you have eventually having even milder symptoms of what I have described to you, it's definitely advisable to go and seek in the clinic for help, and let the clinic check, investigate, and to find out how high and how best we can reduce your blood pressure. People overweight, we call it obesity in the medical world. Obesity is one of the commonest hypertension. People, they should not really unnecessarily eating too much of the food, especially in the evening before going to bed. It's not only that raise the blood pressure, that time going to bed, there also become digestion complication. The food cannot be digested. But once the hypertension has not been diagnosed, has not been investigated, and goes higher and higher, it will affect your heart, your kidney, your lungs. And once it becomes disease of the heart, it means that the vessels, the blood vessels, they have tied up inside. So the blood, which is bringing, we call it oxygen, the food for life, through the veins, arteries, they cannot pass through as fast as before. So they come under pressure. That pressure we transfer to the heart. And for the long term, make the heart dysfunctional, make the heart of the severe palpitation, and God forbid, if that's not been checked, investigated, they will end up with death. Yes, it is. So there is also difference with the blood hypertension between male and female. By female, they have got another period of their life, not only the age, but when the women getting pregnant. The most pregnancies is blood pressure has not been controlled and checked, develop complications. We call them preeclampsia. It means the condition that the blood pressure during the pregnancy is got quite high. That causes the mother and of course unborn baby. There are two people would suffer, and how many babies, how many mothers will we lose because those condition of eclampsia, preeclampsia has not been investigated. That is also the other time for the women, a part of the pregnancy, is when the women to come to their menopause. This is the time when the menstrual period stops. During the time, menopause has got their own symptoms, signs and symptoms. But then a part of those normal signs and symptoms is also the blood pressure can high. It can also increase. The hypertension is an avoidable disease unless there is kind of genetical, inherited hypertension people would suffer from. Otherwise, people can avoid to become hypertension. One thing I have observed, obviously, in the Gambian foods, that too much of palm oil in the food. The palm oil has got a high level of cholesterol. Once it's been used, even twice a day, and for a long time, that affect the inside the veins, like arteria and veins, so that they get tighter. So cholesterol is another, high cholesterol is another way for people developing hypertension. So it means whatever you cook, you put moderately, really moderately. Whatever you cook in oil, you are losing for. Obviously, traditionally in Africa, they use more palm oil. There are dishes that only can can be nice tasting is when it's done with palm oil. Let me tell you one example. I myself, I like this Gambian food called super kanyang. Super kanyang cannot be really cooked with any other oils rather than palm oil. But it has to be moderated. It has not to be too much of that. So please take advice. Make sure that you do not put so much of a palm oil or some other cooking oil in your food, because that can harm not only one person, that can harm gradually the other members of the family. Maybe in younger age, they might not affect them that much. But when the age come about 40 years of age, beyond that, that is the time it can shows. The other thing can raise your blood pressure is to use a lot of salt. Using a lot of salt in the food, that can also bring the same symptoms for the long term, again, of the high blood pressure. So taking and use, that should be very moderately, not too much of it. And once you've been diagnosed with whether it's mild or moderate hypertension, you must take this advice we are giving to you today. Healthy food, not too much of palm oil, not too much of salt, and have some exercise, and definitely make sure that you don't get overweight. One more thing, even newborn baby, they can born with high blood pressure. But then those newborn baby, they might have some abnormality while they was in the mother's womb with the kidneys. And some abnormalities even can affect the blood pressure of the babies. Once the baby is born, obviously we will check for everything of the mother and of course and on the newborn babies. That is what we really wanted to make you aware of it. One more time, 34% of Gambian, they are having hypertension. 80% they don't know about it unless they check for hypertension. In the same level of 34%, we came across in the Gambia high diabetes. Sometimes it's hypertension and diabetes, they are the same level, joint. But for diabetes, we make sure we are giving another talks, another awareness, just talking about the diabetes, signs and symptoms, and investigation, and the treatment. Let's go for the lifestyle. Obviously, the lifestyle, a good lifestyle keep you healthy. Like have exercise, have a healthy food, and you are aware of any kind of disease can eventually harm you. But there are some bad lifestyle. People who drinking alcohol, people smoking, those kind of people taking drugs. Those bad, I call it bad lifestyle, can also not only to bring of developing hypertension, they can give you liver disease, they give you some of the bowel disease, and they can reach, if it's too long, eventually can affect your brain, your lungs. So lifestyle could be a good one, and then you avoid disease. Lifestyle is bad one, then you will end up for developing avoidable, preventable disease, so that once you are healthy, your family will be healthy, and then you will enjoy your life. So please be wise, take care of yourself, take care of the member of your family, and make sure that you at least once a year go into one of the clinics and see senior nurses, doctors, and I just came to do a general checkup. And you will wonder how many times by general checkup we will find out or there is a diabetes, or the blood pressure is, or eventually is a liver disease, or eventually is a sexually transmitted disease. Those diseases I just mentioned to you, they are avoidable. They are preventable. Only advice can be given to you, and we will be happy for you to keep your health, and whatever we can contribute to that, and this is what we have been through these kind of the health programs. We talk to you, we communicate with you, we advise you, and please take advice, and please do not by any starting disease end up, God forbid, become life-threatening and you lose your life or the life of the member of your family. Thank you.